And, of course, Dr. Tim McKnight is in this morning to talk with us. That's the doc. Otherwise, I wouldn't be able to have this. Thank you.
We wouldn't be doing it the same way, at least.
Thanks for coming in. And this morning, I kind of teased a little bit. We're going to talk about knees. And me personally, I'm very aware of athletics and so forth, so I think of knee injuries with athletes and the like. But a lot of people experience knee problems that can come from so many different places, including if you're overweight and you're putting too much, pressure on your knees. Torque.
Yeah.
A lot of serious injuries come without contact.
Right.
With tendons. So lead us down the knee path a little bit, I guess, here. What's the most common knee ailment? Is it arthritis?
It would be arthritis. That's what we see most often in the office. I think you can almost categorize it into three areas. One is the acute injury that the younger people and athletes tend to get, the ACL tears, the MCL injuries, and the cartilage injuries. And then you have more of the weekend warrior, kind of an athlete in their maybe 30s and 40s and 50s who are doing things and they have minor injuries along the way, and then they tear a meniscus and have to have that cleaned. And then you have the run-of-the-mill arthritis, which is the wearing thin of that meniscus or that cartilage pad between the thigh and the shin bone that can break down. And when you lose that pad, you get, as we've talked about with Dr. Jakubowski, you get more calcium deposition, and of course it's painful and it swells, and it's just a nagging problem that sometimes you can tolerate, and at some point, the orthopedic surgeons will say you'll be back when you're ready, because a lot of people are like, I'm not going to ever have anything done. Well, I'll see you in 3 years because you won't be able to handle this much longer, that kind of a thing. So those are the three categories, and I think for all of us it's important to keep the health of our knee intact by, first of all, having strength around our thighs and our hamstrings and our calf muscles. In other words, protecting and strengthening the ligaments and tendons and muscles around the knee joint is the first line of prevention. And then secondly, we overlook flexibility, but that's huge. Most people can't stand straight with their legs together and their knees locked and reach down and touch their toes. We should be able to put our palms on the floor. If we can't, then our hamstrings are too tight, and that makes us a little bit more vulnerable. But then for some reason, some people's cartilage just breaks down faster than others. And so those are the 55-year-olds with a knee replacement.
Is that a protein-based material?
We don't really know. I think, we could talk sometime about telomeres, which is how you can predict how fast somebody ages, how fast their body ages physiologically. And for some reason, some people do. They're more prone to those injuries, and those are the ones that tend to have the replacement surgeries earlier. But again, for most of us, it's that inflammation. Sometimes people will have pain behind the kneecap, the patella, and you can actually have arthritis there as well. There's a little thin cartilage pad between the kneecap and the thigh bone where it slides, and if you lose that, that's a different type of a pain in the front of the knee. Again, I'll go back to, how do you treat this? How do you manage this? Well, good mechanics, restoring the mechanical defects that you might have from previous injuries or just too much sedentary lifestyle kind of things. And then the second thing you do is anti-inflammatories like glucosamine chondroitin. Some people believe that helps to restore some of that cartilage. There's antioxidants like turmeric and fish oil and that category. But again, I wouldn't want people with arthritis to think, I'm going to go spend a bunch of money on supplements and expect this to get better, because it really doesn't. And I've also learned with myself, and I've seen with others, if you eat a very high diet, high in inflammatory foods like lots of sugars and animal meats in particular, you're going to have more inflammation. You're going to feel and notice that pain. I tell my Fit for Life class, if you've got arthritis and you want to be reminded where it is, have a whole plate of cookies. Make a brownie mix and eat the whole thing. You will very quickly, within 24 hours, be reminded where that arthritis is. And that tells us that those foods can cause more inflammation.
So for me, then that's a research project rather than just overeating, is that?
Yeah, it's something that I think many of us struggle with from time to time. But when you have a bad day, pay attention to how you feel. That inflammation is going to go right to the most arthritic joints. But that the reverse is also true. A clean lifestyle, a clean diet can help to minimize that arthritic pain.
In the knee, there's cartilage and meniscus. Difference?
No, the meniscus, the pad is made out of a cartilaginous kind of material, and you can get small little micro tears. But when it tears, it's a very flat, kind of, probably the size of a I don't know, 2 or 3 inch diameter, very small and very thin. And just with the twisting of the knee and the pressure, the weight of the knee, you can get small little tears. When those tears, we call them bucket handle tears. And when they, like a bucket handle, when they lay flat, they don't bother you. But when they flip opposite and and you don't have that smooth surface, then you have more pain. That's when the knee locks. It feels like it gets stuck. It can swell. And then sometimes it's like, boy, it doesn't bother me too bad, and then other times it does. That's usually a sign of a meniscus tear. And really the only thing I know to do to fix that is a arthroscopic surgery to shave that off and smooth it out. Now, stem cell injections and therapies are also a potential for people starting to lose cartilage. If you're in your 40s and 50s, I would consider stem cell injections to maybe restore some of that cartilage. But if it's advanced and you don't have much left, I don't think the stem cell treatments are going to do much. But for those of us early in that process, it might be something to look into.
Is that what the athletes use to relieve pain because they want to play out a season and not have surgery?
I'm not sure.
Because I've heard of injections to keep the knee kind of going.
Yes, we inject a combination of lidocaine and a steroid like Depomedrol. So the lidocaine is a numbing medicine. We would numb your skin up for a cut. So that numbs the knee immediately. And then the long-acting steroid can take the inflammation out for sometimes days, but sometimes 6 months. It's very variable how people respond to that. So that's a bridge. That's a way to manage the pain, but it doesn't fix the problem. It just helps you feel more comfortable. But stem cells are basically premature or immature cells that when they get injected and they go to a location in the body around a certain cell type, they sort of say, oh, this is what I'm supposed to become when I'm an adult cell. I'm supposed to become cartilage. So they help to restore the cartilage in that case. So, like I said, that's an option for some people. But if you're in your 60s and you're really hurting and you're asking me for cortisone injections, you're probably not going to have much luck with stem cells.
Yeah. About, and Robert, unfortunately, had an injury not too long ago. Tore his ACL and his MCL.
Yeah.
Now, surgery is always an option. Can you tear your MCL without tearing the ACL because the medial collateral doesn't seem to twist quite as far?
No, it doesn't twist as far. It would have to be a pretty hard force from the outside of the knee, a lateral force that kind of stretches the inside of the knee and extends that ligament enough to break or to tear. So you can tear an MCL, medial collateral ligament, without the ACL.
He went ahead and did both, but anyway.
Yeah, well, that often happens, and one of the classic signs of a serious injury like that is a lot of swelling and bleeding. So some bruising or something like that, because those do tend to bleed when they're severe enough. And most people can feel that pop, or they've been hit laterally and kind of posteriorly as they're bending their knee. And I wanted to mention to you that teenage girls are very vulnerable to these injuries, and I know in basketball and probably volleyball also. So again, how do you prevent that? Well, that's strengthening the knees. I'm not a big fan of a lot of heavy squatting, but laying flat on a bench and doing the leg press, I think that's safe for the back, and I think lunges are also very good. So those are preventive kind of things.
Get your stretch band in use too.
Exactly. Yeah, but I have seen that people who lift a lot of weight, squat a lot of weight, and who eat a diet very high in animal flesh and meat, they tend to wear those joints out pretty quickly. So a lot of those athletes want that protein to build muscle. I think there's a price to be paid when you do that over the long haul, and especially lifting that much weight. I don't think that's Of course, that builds the muscle, but functionally, I think lunges and maybe just a lot of reps with a leg press is probably better.
Yeah, and unfortunately, just to add to that, most of those, at least in the teenagers, the ACL tears are non-contact injuries where they just come to a kind of a jump stop and the knee keeps going and
right. And you just imagine what happens to these young kids, the 14, 15-year-olds. They're growing. You can tell when a teen is getting ready for a growth spurt because their hands and their feet are the first things that grow. The feet in particular to support them as they start to grow vertically. And then the bones grow and the ligaments and the tendons have to stretch, but there's not a lot of muscular support there. So it doesn't take as much for that real thin teenager who's just hit a growth spurt to tear something because there's already a lot of tension on the tendons and ligaments, and the muscles haven't really formed a strong enough bond to protect them from those forces that would change the position of the joint.
Well, if you're having knee pain, see Dr. McKnight. Because,
I hate for anybody to have pain and not know what to do with it. It's really important. I think that's one of my mantras is get to the root cause and attack it that way. And many times there's a lot that we can do to prevent an extension of an injury or look down the road to prevent a recurrence.
All right. Well, thanks. Continue to eat well and be good. And all that.
Pretty simple, isn't it?
It seems to be.
Yes,
we just follow along. That is Talk with the Doc this morning with Dr. Tim McKnight, brought to you by Mako's Pharmacy, offering their customers and community free assistance with comparing and selecting a plan based on your specific prescription needs. Mako's Pharmacy, 740-922-5400.